afternoon. Osteoporosis is a global health problem, and because of this, worldwide fractures affect 1 in 3 women, 1 in 5 men over the age of 50. Our bones are living tissue that gives our body structure and allows us to move and protect our organs. Bones that suffer from osteoporosis because they become more porous and fragile, making them more liable to break, which can cause considerable pain as well as disability. Many people think osteoporosis is simply linked to old age. The older we get, the more chances we have of developing osteoporosis. While this is true in some ways, age isn't the only factor involved, and osteoporosis is linked to various other medical conditions as well. And you'll be surprised to know that even hormonal imbalances can cause osteoporosis. Many hormones in the body affect bone turnover. If you have a disorder of the hormone producing glands, you may have a higher risk of developing osteoporosis. The good part is there is a lot you can do to protect your bones throughout your life. You are never too young or too old to improve the health of your bones. By being aware of osteoporosis and which factors could place you at risk, you can make sure that you get diagnosed and treated as soon as possible. Today, we have with us eminent endocrinologists who can understand and help you understand, manage osteoporosis. Let me just welcome our doctors, Dr. Jayashri Shembalkar, consultant endocrinologist at the Get Well Hospital and Research Center in Nagpur. We also have Dr. Mukul, endocrinologist from the Tripura Medical College in Agartala. Also, Dr. Chintala, Venkata, Rakesh, this is a consultant endocrinologist from the Sanjeevani Hospital in Vijayawada. Thank you so much and a very good afternoon to you, doctors. Let me take my first question to Dr. Shembalkar. Imbalance as far as hormones are concerned can affect many body mechanisms. How does hormonal imbalance affect our life? Dr. Jayashri Shembalkar.
Yeah, you'll all agree that human body is one of the most miracle which God has created, and it has so many systems, but all these systems work independently as well as in sync with each other. And this perfect harmony of all these systems is maintained by hormones. Hormones are basically chemicals which come out from the endocrine glands. They circulate in the blood and they go inside the tiniest part of our body, and they help to maintain the internal environment as normal as possible. Whenever because of some lifestyle disease or because of some other factor like disease, there is less hormone or more hormone, meaning there is imbalance of hormone, you can have a disease. Like if you have less insulin, you can have diabetes. If you have less thyroid hormone, you can have hypothyroidism. So yes, definitely if you have any imbalance in parathyroid hormone, which controls the bone metabolism, you can have bone diseases. Thank you.
Thank you so much, Doctor, for answering that question. And as we discuss, hormones are interconnected and their balance affects the function as well as the health of body systems. Which hormones affect the bone health and how? If Dr. Mukul could take up that question.
Yes, thanks for the question. At the outset, I sincerely congratulate NDTV for this initiative and bringing out this important but less discussed health topic on bone health, which is extremely important for a future healthy India. Coming to your question, there are mainly 3 categories of hormones which affect bone health, and they are calcium regulatory hormones like parathyroid hormone, calcitonin, and calcitriol. Then we have sex hormones like testosterone and estrogen, and then we have systemic hormones like growth hormone, thyroid hormone, and cortisol. Among these 3 calcium regulatory hormones, the parathyroid hormones maintains the normal level of calcium in the blood and then keeps a balance between both bone breakdown and bone formation. If you take another one, the calcitriol, the hormone derived from the vitamin D, it stimulates the intestine to absorb enough amount of calcium in our body. Then we have got the calcitonin, which inhibits the bone breakdown and may protect against the excessive level of calcium in the blood. Among the sex hormones, the male sex hormone testosterone is important for both skeletal growth and muscle growth in males. Then we have got the female sex hormone estrogen, which acts on the both bone forming cells and bone resorptive cells to inhibit the bone breakdown. Also, we have got the systemic hormones like growth hormone, thyroid hormone, and cortisol are the other systemic hormones which are essential for growth and acceleration of skeletal growth at puberty. Therefore, let's agree with the fact that all these calcium regulating hormones, sex hormones, and systemic hormones all are critical for healthy bone and their imbalance can lead to bone loss and reduction in bone density, which is better termed as osteopenia and osteoporosis, which is our topic of discussion today.
Right. Thank you so much for answering that question. My next question is for Dr. Rakesh. Can you tell me if osteoporosis is more common in women or in men? Dr. Chintala, Venkata, Rakesh.
Good evening. This is a good question.
Yes, go ahead.
Osteoporosis is more common in women rather than men. Actually, in fact, it is called like osteoporosis is called as postmenopausal osteoporosis. The reason being because estrogen is the main hormone which is responsible for the bone health. If estrogen is not there, either due to natural menopause or by surgical or by drugs, the estrogen deficiency causes bones weak and makes the woman more prone for fractures. So earlier the menopause, more is the risk of osteoporosis. So definitely compared to men, though in men osteoporosis can occur, but osteoporosis is much more common in women. And irrespective of the age group, if a woman attains menopause at an earlier age, whatever may be the cause, the patient has to be screened for osteoporosis. And we see that by BMD, bone mineral density, and depending upon that, the patient has to be treated on with therapy, because majority of this disease most of the times is asymptomatic rather than the symptoms.
Right. Thank you, Dr. Rakesh, for answering that question. My next question, there are many health conditions and problems that increase the likelihood of osteoporosis. Which are these conditions? Dr. Jayashri Shembalkar, if you could answer that question.
Yeah. See, whenever you are talking to any elderly person, what they tell you is, I'm not afraid of death, but I don't want to suffer from fracture, or I don't want to be bedridden. And hence it is extremely important for us that we should identify people who are at risk of developing osteoporosis and fracture so that we can prevent fracture. So prevention of fracture starts from identifying people who are at risk of developing fractures, isn't it? So at risk, we are definitely, as we heard from last two speakers, that females are more prone for osteoporosis. So menopause causes osteoporosis. So every postmenopausal female is prone for osteoporosis, especially if your mother had fracture, then you definitely are at increased risk of developing fracture. Leaner you are, there is more chance of developing fracture. There are certain diseases, very common diseases, like you must have heard rheumatoid arthritis or diabetes or excessive thyroid hormone or excessive steroid hormones. They also make you prone for development of osteoporosis and fractures. Many drugs which we take because of some other diseases like steroids or anti-epilepsy drugs, or many times antacids taken indiscriminately without anybody's prescription, those can also cause osteoporosis. But mind you, it is not osteoporosis alone, but it is also a tendency to fall in geriatric population, which is extremely important. And we should identify diseases which make them prone for fall, repeated falls. Like if an elderly patient has a stroke or loss of balance because of, say, Parkinson's disease or multiple sclerosis. Now, these are the patients which you should identify, and you should protect them against fracture by starting osteoporosis treatment before they develop fracture. And that is extremely important to avoid getting them fracture and avoid them getting bedridden. And hence it is extremely important to identify people who are at risk of developing osteoporosis.
Right. Thank you so much, Dr. Jayashri Shembalkar, for getting us all those details. My next question, are women more likely to develop osteoporosis after pregnancy? Is it due to hormonal imbalance? Dr. Roy.
Yeah, thank you. So you see, the main objective of calcium adjustment, as just now our speaker has mentioned, it is during pregnancies for adequate placental transfer of the calcium to the fetus for a healthy fetal skeleton to develop. And you know, 80% of the calcium amount is transferred to the fetus during the last half of the pregnancy. This means that any imbalance in the nutrition or the prior osteopenia, if exists in the mother, will lead to further decalcification of the mother skeleton. So if you go to the recent clinical studies, it is suggesting that second half of the pregnancy involve more bone loss, and the transient reduction in the bone mass may pose more women at risk. So you see that there is deterioration of the bone density, which further accelerates during lactation after the pregnancy, when the maternal bone remains the main source of the calcium and goes to the newborn with the breast milk. But we do have limited data on the specific drugs for osteoporosis like teriparatide and bisphosphonate, which can be used in lactation period after the pregnancy. So therefore, these drugs should be used only with specific indication. At this point of time, therefore, management of osteoporosis after pregnancy has to be more of preventive, and that has to be with adequate calcium and vitamin D and nutritional supplementation.
Right. Thank you so much, Dr. Roy, for answering that question. What are the signs and symptoms of one of those worries? What does one need to look out for? Dr. Rakesh, if you could answer that.
This is a good question. Why do we screen for osteoporosis? The reason being, majority of the times, osteoporosis is asymptomatic. When a disease is diagnosed in the earlier stages and they are symptomatic, you need not have any screening test. You can directly go for the diagnostic test. But when the disease is asymptomatic, for majority of times, like diabetes, like thyroid, and like osteoporosis, it has to be screened at appropriate place and appropriate time. So these patients will not be having symptoms majority of the times, though they might be mild aches and back pains. These women have to be screened. And in the clinical features, coming to clinical features, vertebral fracture, that is fracture in the back, that is spine. These are more common, and at the same time, fracture in the hip is also common, and fracture at the wrist, that is called Pullis fracture, the forearm fracture is also common, and the humerus fracture. These are the four sites where fracture can occur, the vertebra being the most common. So whenever the woman comes to you with complaints of these fractures, and these fractures particularly occurs after trivial trauma, means just a simple fall. The trauma that is not sufficient enough to cause fracture in an otherwise healthy person. So if the fracture occurs with minimal trauma and the patient is a postmenopausal woman, whatever may be the cause, and the patient is having aches and pains, and there are multiple fracture history, and there are other causes like hyperthyroidism and diabetes, as Madam mentioned, definitely these women have to be screened for osteoporosis by bone mineral density testing, and this has to be started at the earlier age so that the treatment can be initiated and we can prevent further fractures and further worsening of bone in the future.
Right, Dr. Rakesh, they're telling us the signs and symptoms that one needs to look out for. With that, we're slipping into a very short break, but we'll on the other side get you all that you need to know about osteoporosis. Stay with us. Welcome back. We have with us Dr. Jayashri, Dr. Mukul Roy, as well as Dr. Rakesh with us. We're talking about osteoporosis today. My question goes to Dr. Jayashri. Dr. Jayashri, does estrogen replacement therapy prevent osteoporosis?
Yes, it definitely prevents osteoporosis. As you have heard from all these speakers, they have told that all the osteoporosis is more common in females because of deficiency of estrogen. Now, our ladies or our bodies are used to estrogen right from starting of menstrual cycle up to the end of menstrual cycle, what we call as menopause. So whenever after menopause there is deficiency of estrogen, we tend to lose bones. And this loss of bone occurs early after menopause, say maybe 5 to 10 years after menopause. So if you can treat right lady with estrogen at the right time after menopause, definitely estrogen can prevent osteoporosis. Sometimes menopause also occurs quite early. So in those patients, if you treat osteoporosis with estrogen, it definitely helps in building up their bones. But one thing has to be very, very clear, that estrogen therapy should never be started without consulting a doctor, because there is some checklist of blood tests and there is some checklist of diseases where estrogen cannot be given. So estrogen therapy if you select a right patient, if you start at a right time, can definitely be helpful.
Right. Dr. Roy, is it possible to reverse osteoporosis? Can healthy lifestyle choices make any kind of difference?
Yeah, definitely a nice question, and possibly your question is itself a hope for the future. See, as we discussed, though only few drugs like estrogen replacement, then teriparatide, they stimulate the bone formation. But as of now, if you think largely, once the disease of osteoporosis sets in, then it is not reversible. However, it is much preventable before the disease sets in with the larger extent, and that is only possible with the adoption of a healthy lifestyle. So healthy lifestyle includes the evidences for dietary inclusion of fruits and vegetables, seafood and milk products. Then again, in dietary supplements, you have got adequate calcium and vitamin D supplementation are very important for osteoporosis prevention in specific age group population. Then also engagement in the regular exercise can help your bone to stay strong in adulthood, but of course, definitely it has to be under a doctor's supervision. So you can engage in 3 types of exercise. All of us know that weight bearing exercise, resistant exercises and stretches. Definitely another preventive approach, and healthy lifestyle obviously includes the avoidance of addiction like smoking, and definitely if not abstinence, at least limiting the alcohol intake. So to summarize, healthy lifestyle for healthy bone and for osteoporosis prevention has 4 pillars. Number 1, healthy diet. Number 2, regular exercise. Number 3, use of supplements in the form of calcium and vitamin D in specific age group like elderly male, in pregnant and in postmenopausal female, and then obviously avoidance of addiction.
Right. Talking about exercise, how much exercise does one need to boost bone strength, and which exercises do you recommend? Dr. Rakesh.
The exercise, this is again a good question. Always people ask, how much amount of exercise do I need to do to protect my bone and to prevent osteoporosis? Here 2 points are important. The regularity of exercise is more important than the intensity of the exercise, right? That means a high intensity exercise compared to a regular low intensity exercise, which is more better. Regular low intensity exercise is much more better. So intensity doesn't matter, the regularity matters. And what are the exercise types that have to be done? There are 2 types of exercise. There is weight bearing exercises and the non-weight bearing exercises. Weight bearing exercises like walking, dancing, jogging, skipping and walking on a treadmill. Non-weight bearing exercises are strength training exercises and posture training exercises. Osteoporosis fractures, majority of the times they occur due to falls. So in our exercise curriculum, both the weight bearing exercises and the non-weight bearing exercise has to be included. Daily 30 minutes of exercise most days of a week, that means 6 to 7 days of a week, and along with that 2 to 3 times a day or 2 to 3 times a week, we have to include strength training exercises and posture training exercises. These strength training and posture training exercises like simple weightlifting of 1.5 to 2 kgs, so that it increases the muscle strength and prevents the falls and prevents the fracture risk, particularly at the hip joint. So 30 minutes a day of most 6 to 7 days a week, and 2 to 3 days a week of non-weight bearing exercises like strength training and posture training exercises are very important, so that the fractures at the hip are prevented. When the weight bearing cannot be done, even simple walking or brisk walking can be done, so that it increases the bone turnover and at the same time calcium deposition and prevents osteoporosis.
Right. Now, does androgen deprivation cause bone loss? Dr. Jayashri.
We were all the time talking about estrogen up to now, but we all know that even androgen deficiency can definitely cause bone loss. There are certain conditions where androgens are deficient because of diseases, even in young male patients, and we know that they all suffer from androgen deficiencies. There are few diseases like carcinoma of prostate, where we are giving androgen blocking agents as a treatment for carcinoma of prostate. And those are the patients where osteoporosis really develops. So yes, androgen deficiency can definitely cause secondary osteoporosis. and we need to be on watch out whenever we are giving these therapies to the patients.
Right, we've spoken about exercise, but what about diet? Which diet or food should be followed to help manage osteoporosis? Dr. Roy.
Yeah, thank you. Well, let's address this question a bit hypothetically. So if you go in one prominent study on the bone health, 6 dietary patterns were identified with the main proportion of energy intake from the following. Number 1, meat, dairy, and red groups, and meat and sweet back products, then alcohol, candy, and then the last option was fruits, vegetables, and cereals. For both men and women, the fruit, vegetable, and cereal group had the greatest bone mineral density at all bone sites examined. Again, if you consider the potassium and magnesium, they are the 2 main dietary constituents found in fruit and vegetables that contribute to a higher alkaline state within the body and prevent bone loss. So again, higher intake of the low fat milk products are associated with higher BMD. Sometimes greater protein intake also benefits your bone mineral density, but it has to be with an adequate calcium intake, just we discussed before. So well, apart from all this in supplements, we have got the recommended dietary calcium allowance for a first 3-year age group. It is around 700 to 800 milligram per day, and it becomes 1,200 milligram per day more than 51 year to up to 71 year of age group. In cases of pregnant and lactating mothers, it becomes around 1,000 to 300 milligram per day. Similarly, if you consider the vitamin D supplementation, it is generally 600 international unit per day for all groups, except individual older than the 71 year of age group, for whom it is requirement is around 800 IU per day. So you have to go for the enough amount of cereal, fruit, vegetables. Along with that, you have to go for an adequate calcium and vitamin D supplementation in specific age group.
Right. Thank you so much, Dr. Roy, Dr. Jayashri, as well as Dr. Rakesh for joining us this afternoon on the Health Wellness Myth versus Facts here on NDTV 24/7. But that was a short break. Lots more coming up on the other side.